Assalamu alaikum, guys. So this is part 2, moving on to the actual scientific studies that were done. So some of the scientific studies were done on actual weed use, like the way people actually use it, which is smoking it. Not that many are done on vaporization or like vapes that people use nowadays, but although they might have done a few on those. And a lot of the conclusive studies though were done on medications that were made from marijuana or cannabis extracts. So you'd have synthetic THC that was made as a drug, and you'd also have natural cannabis extracts that were made as a drug. And some examples include dronabinol, which is synthetic THC, and that's a medication that doctors are using now for vomiting and nausea that comes with the chemotherapy that they do for people with cancer, because how bad the chemotherapy messes people up. They also have something called cannabidiol oral capsules, which is the CBD I was telling you about in part 1. They just make it into an oral capsule. This is an interesting drug. They have another one called Epidiolex. 98% concentrated CBD oil in a capsule form, and they use that as an anti-seizure medication, right? And then you have nabiximols, and that's called Sativex. Nabiximol would be the trademark name for it, and Sativex would probably be the generic brand. I don't know, or maybe I'm switching them up. I'll let you guys. I'll put the source in the description below. You guys can read the study for yourself. The studies for yourself. They're very long, and some of them are very well done. So that's a natural extract as well of CBD, the cannabidiol, to the THC in a 1-to-1 ratio, and they use that for multiple sclerosis. So with multiple sclerosis is a nervous system disorder where your nerve cells or your neurons start to degenerate, and it fires off irregularly, right? And a seizure is what happens if your nervous system starts firing all at once. Then your muscles start to spasm, and your muscles start to contract and decontract very quickly. And some people have seizures that are so bad or epilepsies that are so bad that like the muscles rip from how severe the seizure is, right? So, anyways, they're using these types of drugs, and because the doses are known, and because it's an oral capsule, and because it's more observable. The studies done on these types of medicines are conclusive, right? And I'll get to that in a little bit. But just keep in mind, guys, that out of all of the people that smoke weed, statistically only like 10.5, 11% of that number use it for medicinal purposes. The rest is all recreational. So anyways, moving on. We have conclusive evidence, as I said before, for the multiple sclerosis patients, for multiple sclerosis. We also have it as for the chemotherapy, getting rid of the side effects of chemotherapy, and for chronic pain, they were giving people, I think it was dronabinol. I think it was dronabinol for the chronic pain, right? So we have conclusive evidence for all of those. It reduced pain versus placebo. They were, for the nausea that came with chemotherapy, the weed-based medicines were just as good as the other based medicines. Now, moving on from those three things that I said, multiple sclerosis, the chemotherapy, what's that in my finger? Chemotherapy side effects, and the third one, which was chemotherapy side effects, multiple sclerosis, and the third one, which was chronic pain. Okay. Even though they use anti-seizure medication, the studies that are done on it are still not very high quality, even though they have the medication for it and they've used it. But the actual studies done are not high quality, because making a scientific study is a process. You don't just give medicine and say, oh, it worked, see, it worked. No, you have to study it and compare it to other medications, and there's a whole bunch of things that go into making a proper scientific study. So as for cancer, there's no evidence, even though the cannabis extracts, certain cannabis extracts have a anti-cancer effect, but again, no studies are that good that have been done yet. Anorexia was interesting, that when people lose a lot of weight and they have anorexia, or sometimes they're unable to eat, they lose an unhealthy amount of weight, the weed actually didn't help, even though one of the popular side effects is that you get some what's called the munchies and you eat a lot. So with that, it didn't help. And then the scientists who were looking at those studies, the reviews were saying, maybe we gave them too small of a dose and that's why it didn't work. Maybe there's another chemical compound in the weed besides THC and CBD that makes people hungry. Because again, they were giving the oral capsules. They weren't actually smoking weed. A lot of these patients, when we're looking at the medical studies, right? Seizures and epilepsy, there was no evidence, right? Like I said, no evidence because the studies just aren't done. However, certain doctors gave their patients medications and they just observed through case studies that it works. No official studies yet, right? But one guy was saying that they gave CBD and THC at a ratio of 20-1, so 20-1 ratio of the cannabidiol to the THC, and for 6 months to 74 children with epilepsy, 18% experienced a 75 to 100% reduction in seizure frequency. 34% of those kids increased. Reduction of seizure frequency decreased by 50 to 75%, and then they go down. Only 7%